My name is Diane Calinski, and I am a faculty member in the Pharmaceutical and Graduate Life Sciences Department. We have faculty members that teach in the pharmacy program, in the pharmacogenomics program, as well as our nutrigenomics program. And I predominantly teach in pharmacy and pharmacogenomics. I also have a small laboratory where I do some benchtop research. So I've trained a number of students in how to understand drug metabolism. So before I joined Manchester University in 2013, I did not understand what a pharmacist really did. I thought all pharmacists worked at Walgreens and CVS's and Rite Aids, which I thought was always a very noble profession, and it is a noble profession, but I felt that the PharmD would have been very limiting to many graduates. And it wasn't until I became a faculty member in a pharmacy program where I really got to understand all of the different job opportunities that are available to PharmD graduates. So you may be familiar with hospital settings, but there's also ambulatory care settings where pharmacists work directly with patients and manage their care over long periods of time. They build relationships with those individuals and those patients and their families and make a true difference in their lives. So our pharmacogenomics program has several branches, different ways that you can educate yourself in pharmacogenomics. Pharmacogenomics is the study of how genes impact your ability to metabolize a drug or how a drug will interact with your body. And when an individual gets a master's in pharmacogenomics or a graduate certificate in pharmacogenomics from Manchester University, what that does is help them to understand the next level of drug interactions, and that would be the drug-gene interactions. And so we have dual degree students that are earning both their pharmacy degrees as well as their master's degree in pharmacogenomics, and that makes them true specialists in that field. Then we also have students that are earning their master's or graduate certificates, and those individuals typically are working in pharmacogenomic laboratories, helping to pave the way into the new frontier of personalized medicine. They're helping to process patient samples and look at genotyping results and make classifications on genotyping results that then impact how a patient will take a medication. So nutrigenomics, the really cool thing about our nutrigenomics degree is that when you finish this degree, you end up being able to sit for your dietitian exam. The only difference between our degree at Manchester University and other dietitian exams or dietitian degrees is that you do get a genetics component to this. And this is truly the frontier of nutrition and dietetics and where this is going. So we've already done it in pharmacy education, and we've done it with pharmacology in general. We understand that when you take a drug, it is going to be impacted by your genetics. What we're starting to gain an understanding of is how the food that we put into our bodies are also being impacted by our genetics. And so while you gain the ability to sit for your registered dietitian exam in completing your Master's of Nutrition at Manchester, you also gain that additional knowledge that is going to be impacting your future practices. So I was born and raised in Buffalo, New York, and then I went away for my undergraduate education. I went to Penn State University, and then I did my graduate work at the University of Michigan in Ann Arbor. And when I moved to Fort Wayne, I knew nobody in Fort Wayne. Everybody that I talked to about moving to Fort Wayne had said, well, I knew somebody who once lived there. So it seemed to be kind of a city that was definitely a transitional city for many people. And I'll say that that may have been my intent when I came here, but within 2 years of being here, I really fell in love with this city. Fort Wayne has a great history, a really strong history that I got to learn all about as I live and breathe in the downtown area. It's developing. We've got all kinds of new exciting things going on. When you walk downtown, there's always a new restaurant or a new kind of event that you can partake in. We've got new parks opening up, beautiful parks. We have rivers that now we can use. It's just turned into a really great, thriving city. Now, 10 years on, I can't imagine living anywhere else. So for fun, one of the things, I don't know if I would consider this fun, but definitely for wellness, is I practice yoga very regularly. I've been doing that now for 20 years. One of the things that I get to do is I get to share that love of yoga and meditation with our students. So over the years, I've hosted several yoga sessions with them. I've got one coming up here on April 10th, where I'm gonna work with all of our Fort Wayne students to just come in and just kind of do some gentle breathing, gentle stretching together, and hopefully kind of take down kind of everybody's little anxiousness about entering into finals time and wrapping up the semester. So I've traveled to a lot of different places, been very blessed, very lucky to do that. And a few years ago, I got to travel to Brazil with my husband and his work. And we spent a few days in Brazil, and I learned a few words in Portuguese. I learned 3 words. I learned tudo bem, which means like, what's up, how's it going, how's it hanging? I learned obrigada, which means thank you. And I learned pão de queijo, which is cheesy bread because it's delicious.